Hi, I'm Dr. Vali from LMS Wellness. Welcome to Bazaar Beauty. I'm going to talk to you about all things cosmetic dermatology and medical wellness.
So I know you travel around the world seeing patients and patients fly into you, but for those of us that can't get to you, what should we look for in a doctor that isn't you?
That isn't me?
That isn't you.
No. I only have one tiny pair of hands.
Exactly.
So if you're not coming to see us or my brand or any one of my doctors or my team, the one thing you should immediately look for is comfort with your doctor. So you should be able to be comfortable to ask the questions. Okay. The next thing you should look at is look at the doctor. Look at their presence, look at the way they look. Are you comfortable with the way they look? The third thing you should ask for is actually to speak to one of their patients. Okay. See what the patient's journey has been with that doctor. And I'm going to clarify one thing. It is very easy to inject, to treat, to carry out a procedure on someone. It is the aftercare that kills you. And when you look for a practitioner or a doctor, really question the aftercare process. What if I'm not happy? What if I want a review? What if I'm confused? Really say, are you approachable? Who in your team will liaise with me? What if I'm upset? What if my expectations weren't managed? It's the aftercare that you should pay for. Yeah. So the actual procedure, fine. Someone has to have a skill set, the aesthetic eye. They have to assess you correctly. That should be a given for doctors. So that's why, you put a lot of faith in doctors, but you also want to know about that aftercare journey. And then, obviously, basic knowledge, what qualifications they have. So I went to King's College London, I went to UCLA, I'm board certified twice, cosmetic dermatology, I'm on several boards, I'm a speaker. You want someone who keeps up to date in their knowledge and innovation in medicine and medical changes.
What sort of qualifications does someone need to administer non-surgical?
So it depends what country you are around the globe. So in terms of the GCC, you have to be dermatologist or plastic surgery or under license. So that's good. Okay. In terms of in Europe, you can be a nurse, you can be any type of doctor. So there's nothing wrong with it, and I'm not going to berate other specialities, but just make sure your doctor is doing the right thing for you with the right approach, which means really question the theory behind his or her thinking. Why do you think I need lips? What about the rest of my face? How would it fit into my facial proportions? What would the filler look like in 3 months' time or 6 months' time? What if it goes wrong? What's your aftercare? Or why do you think I need Fraxel laser resurfacing at the age of 25? What's the long-term prognosis in that in 5 years? Is my skin going to be loose and lax afterwards? These are things your practitioner should be able to tell you, and if they can't, walk away. Word of mouth is the greatest, most powerful form of referral. So look at your group of friends, find someone who you think's been tweaked a little bit, looks a bit fresher without them admitting it, and really push them to find out who they've gone to. That's great, if they'll tell you. Because most people are like, I promise I haven't done anything.
But they have, right?
Yeah, but there's nothing wrong with, it's privacy. So I can understand that, but if they're your good friend, they'll want you to be happy too.